Hello everybody, so here's the scan results from um, March 20th, I believe, or 21st. That's when they were resulted. Anyway, so it shows progression, so that means it's time for a medication change. So this was a PET scan. For the head and neck, the biggest thing were lymph nodes, lots of lymph nodes. And this SUV, this means how much activity is in the lymph nodes, and that's pretty high. In the past, like 2.3 in the low, high ones would be kind of a background type of radiation measurement. So 19 is quite high, so that's not good. And that's the one lymph node on the right side that's been it sticks out just a little tiny bit, but it makes it puffy in that area. So, and there's on the left side, there's another one. It's also getting bright. And there's some other ones in there, but so basically the lymph nodes by the clavicle, or people call that the collarbone, there's a lot of them in there that are swelling up. I don't have the DVD yet, but as soon as I do, I will be uploading the video of that so you can actually see what that looks like. In the chest wall, so according to this, I do have a moderate pleural effusion. I can't remember where it says that. But anyway, that means I have fluid in between the lung and the wall that goes, the sac that goes around the lungs. But there's some stuff, what I don't see is I don't see tumors in the lungs, which is really good. But I do have a lot of little nodules in that pleural space between the lung and the sac that goes around the lungs. And that's getting inflamed and causing fluid to build up, which can make it kind of hard for a person to breathe, which I've been experiencing, but not terribly so. So I'm not worried about doing any kind of procedure to release the fluid. Hopefully it will go away on its own, because sometimes they do. But there are definitely a lot of lymph nodes that are hiding in and not in, but around the lungs. And also there are lymph nodes where the diaphragm, which is between your lungs and your guts, or your intestines, if you want to call it that, because that's what they are. There are some new ones there, and I haven't had them there. I'm not sure if I've ever had lymph nodes in that particular area, but so that's new. Okay, so I'll definitely be keeping an eye on that. But liver's good. I have no tumors in my liver. That is freaking awesome. Normal gallbladder, spleen is normal, which is awesome. That's, again, right here. It says about the periphery. Those are those lymph nodes I was talking about by the diaphragm. So there's something going on there, but I don't know what. But pancreas is good. Adrenal glands are good. Kidneys good. GI tract, that's your intestines. That's good. And but again, the lymph nodes, just lots of friggin' lymph nodes. The biggest ones are up in the neck area, which is, to be expected. But there are some other ones that are in the rest of my body. But again, a lot of good information here. Bones, it says I have more progression and diffuse osseous whatever. And, so basically they're saying that the bone tumors are more active and they're growing. And there's more of them. So, and this C3, C6, that is in the upper part of the neck. Where between where your neck touches your shoulder and the base of your skull. So it's kind of, upper part towards the middle. Actually, C6 is I think there's 7 cervical vertebrae, and so that means it's near the base. So there's one in the middle and one at the bottom. And then I've got some couple new ones in there. So second rib, multiple right posterior rib. So I didn't have any rib tumors before, so this is new. I did have sternum, I did have some spinal, and I did have a couple in the pelvis. So if they're actually in the ribs, that is new, and that could be why I'm having rib pain. But again, they say overall progression, multiple sites of hypermetabolic, which means when you look at the scan, that means that the tumors absorb more radiation and they give off the radiation more than the rest of the body, because the hyperactive sugar, or excuse me, the radioactive sugar is all going to one place. So when it's emitting its radiation, it's kind of like a beacon. And that's what highlights all of the tumors or other places of severe inflammation. Because remember, these PET scans don't only show cancer, they can show places where any kind of hypermetabolic activity is going on in the cells, which is not always cancer related, by the way, so just keep that in mind. But anyway, definitely time for medication change. My doctor is wanting us to go into Piqray, which is specifically made for the mutation of the PI3CK. Okay, I can remember. It's a mutation. So they have a medicine that will specifically target that mutation and hopefully slow down the cancer again. Some people get really bad high blood sugar. Others get diarrhea, and others get the rash. But not everybody gets everything. Some people get nothing. So I'm hoping I'm in the nothing group, because letrozole and Ibrance really worked well for me for 3 years. Considering that the average response time is 2 years, I'm grateful that I got 3 years out of it before I really had to change. But I don't think I want to try pushing this Ibrance another 3 months, because I'm starting to feel the effects of the tumors now. So, but anyway, not great news, but not terrible. Great news is nothing in the lungs, nothing in the liver. Those are nothing in the brain. That we didn't look for anything in the brain, but we didn't actually see anything in the brain. I don't have any brain symptoms. But so that's good. The major organs are still clear. We just have a lot of lymph nodes and some spinal stuff, and we can take care of that. So I'm still hopeful that I'll be around for some good time, and maybe live for that darn cure to come out. So hang in for the video. If you have any questions, please post. I'm happy to share any information. But I'll be uploading the DVD here probably in another 4 or 5 days once it gets here, and I can make the video for it. Thanks again for watching.